Hi, this is David Parra with AARP Arizona. Welcome to our first Facebook show on the topic of long-term care. The topic today is long-term care in our healthcare system. And I have two guests in the studio with me, which I will introduce in just a bit. Long-term care is a range of services and supports that help people with activities of daily living, mostly not medical in nature and generally not covered by regular health plans. Activities of daily living may include bathing, dressing, toileting, transferring to or from bed or chair, care for incontinence, eating, and other. There are also instrumental activities of daily living, such as housework, managing money, taking medications, preparing and cleaning up for after meals, shopping for groceries or clothes, using the telephone or other communication devices, caring for pets, and responding to emergency alerts such as fire alarms. People often need long-term care when they have a serious ongoing health condition or disability. The need for long-term care can arise suddenly, such as after a heart attack or stroke. Most often, however, it develops gradually as people get older and frailer or as an illness or disability gets worse. Again, long-term care is generally not covered by regular health plans, and it is very expensive. Learning about long-term care and planning for it, therefore, is vital. Long-term care is very much linked to caregiving, and caregiving is very important to AARP. I asked Dana Kennedy, AARP Arizona State Director, to briefly explain why AARP is so devoted to addressing the issue of long-term care and caregiving. Here is her answer.
So, caregiving is the informal part of our long term care system. So, many family members are caring for their loved ones at home, or they may be helping them age in place. And so, as somebody ages in place, they need all kinds of help and services sometimes. Some people don't need any assistance whatsoever, but some people do. And Arizona has one of the highest rates of Alzheimer's in the entire country. And that's a very progressive disease that impacts, at first the brain and then all other functions. So a family that is caring for somebody with Alzheimer's is going to have a different experience than somebody who's caring for somebody who's just aging. And they may need help with just medication, transportation to a doctor's appointment. It just really varies. And every person and every family's experience regarding aging in place and navigating our long-term care system is different.
So AARP is looking for more options, I would imagine, in this vague, sometimes vague, missing link kind of care that it's sometimes not until it hits you, it really hits home. I went through the experience of the coronavirus. I've shared the story of seeing how my wife had to step up and take care of literally four people, and it was brutal. And that is the kind of care that we are talking about when we talk about long-term care. I have to believe AARP is very much in favor of advocating for better system, better, more options so that people age in place in the community as opposed to going to a nursing home.
Yeah, I mean, some people are navigating, caregiving from a distance,
Mm,
and that is possible. And then some people are actually bringing a loved one into their own home if possible. And we
right.
know that, COVID has really impacted the family and has really shown all the flaws with our long-term care system. I think we saw in congregate settings, people didn't even understand the difference between a skilled nursing facility, an assisted living facility, and a small group home.
Right.
And they didn't understand why they couldn't visit their loved one, and it really depended on what level of care they were receiving. So that's why AARP is at the forefront of this. We always have been, and we want to support the family caregiver and help them navigate their long-term care journey.
So glad to work for an organization that takes the care of people, and especially in this particular area of long-term care as our focal point. Thank you so much, Dana, for joining us.
Thank you, David.
We have the luxury of having Dr. Len Kirshner as an AARP volunteer. Len is a former director of the Access Program, which is Medicaid in Arizona. I asked him to share on the history of healthcare in the United States and his perspective of whether long-term care is currently part of our healthcare system. Here's what he had to say.
Long-term care in America is not a system. It's chaotic and divided. So you can go back in American history to figure out where we've been and how we got it. Certainly, one of the first places that provided long-term care was in the VA system for soldiers coming back, starting in the Civil War, World War I, and World War II. In the private sector, Blue Cross started in 1929 in Texas, Blue Shield a decade later in Texas. Those insurance programs never really looked at long-term care. It was always acute services for injuries and acute illnesses. Medicare and Medicaid came on in 1965, but long-term care was not a part of the Medicare program, and it became obvious after a short time that long-term care was needed. Medicaid became the de facto fallback, but in order to be on Medicaid, you had to spend down. There were efforts to improve long-term care in Medicare in 1988 when Ronald Reagan was president. It was Medicare catastrophic. It was a great piece of legislation, but the financing was going to be an income tax surtax, affluent seniors who would then pay $800 a person or $1,600 a couple. They did not like that. AARP supported the bill. They lost almost 3 million members because of that support. The bill was repealed in the first year of George H.W. Bush administration. There have been attempts since then under the Clinton plan, the Obama plan, and the efforts to make long-term care insurance available. Arizona's long-term care system evolved out of the development of the Arizona Access or Medicaid program. The program started in 1992. We did not have a long-term care system. We got our waiver from the federal government to start the Arizona long-term care system, better known as Altex, in 1988. People do not want to go to a nursing home. Arizona's waiver allowed that to occur. It requires renewing the waiver every 5 years. The current waiver expires on September 30th this year. That renewal process is going on right now. Looking at the current situation in the Biden administration, yesterday he announced his plan for transforming America, an infrastructure plan. He went to Pittsburgh. And in it, he also dealt with long-term care service. And the headline reads, Biden wants more seniors to get care at home instead of in a nursing facility. That is breaking news from yesterday.
Amazing.
Passing the Congress in that infrastructure bill for $400 billion care at home and community-based services. And David, we have been dealing with that issue at the legislature for years. We have had rallies at the legislature to make sure that they continued funding home and community-based services, not just for Altex, but for the area agencies on aging, which provide some service to individuals who are not quite ready to be on the Medicaid program.
Dr. Len Kirshner, thank you so very much for this explanation of the history of it and even bringing us to the present. Thank you so much. With me in the studio is Lupe Solis, former Director of Advocacy with AARP Arizona and currently a volunteer. We also have Rich Stephen, a former Director of a nursing home and currently a volunteer with AARP. Lupe, in my early years with AARP, I learned from you about home and community-based services, which is linked to long-term care. From your perspective, is long-term care part of our healthcare system? And why is HCBS so important?
Definitely be part of our healthcare system for the elderly. Unfortunately, because of payment mechanisms, oftentimes people cannot avail themselves of it. But home and community-based services is an extremely important part that people should know about. And most people don't. Most of my work during my years at AARP was in informing people of where they could avail themselves of assistance, either medical or non-medical.
So Lupe, where does the idea of home and community-based services come from? It used to be that nursing home was kind of like the place for long-term care. Research shows that people want to age at home in their community as opposed to going to a nursing home. So what does HCBS does in that regard?
Well, HCBS came about as a result of the realization that if we treat the need for long-term care only in facilities, nursing skilled care facilities, we would never be able to meet even part of the need. Home and community bases came about as a result of the acknowledgement that people want to stay at home and that the easiest and less expensive way of caring for them is at home with services as you outlined earlier. They could include assistance all the way from dressing, bathing, getting their medications, to the actual medical help of a nurse coming into the home to check on whatever the condition of the person is on a regular basis. You also mentioned that unfortunately long-term care is not paid for by except under if you are in extreme need of it under access, and also not covered by most regular Medicare plans. Some people have availed themselves of long-term care insurance, which sometimes helps. Not all the time. Sometimes it's only designed for institutional care. But it is really important that people understand that there is a service, there's a continuum of services that is available or can be attained if you know where to go into the system to obtain it.
Right, right.
Starting with the area agencies on aging, because of course you can get it privately. It's expensive.
You know, I contracted the coronavirus, and my parents did as well in my own home, which it was a terrible feeling. My son, 19 years old, also contracted the virus. Fortunately, my wife didn't, and I just saw how it was. I used the word brutal on her. It was brutal on my wife, having to take care of myself, who isolated, my parents, cooking, going shopping, the medications, calling doctors. And if she had been working, then we would have been in deeper trouble. You know, where are we going to get that help? So even though we have managed at AARP, I mean, we do a lot of advocacy around caregiving. It was not until we had this experience that it really hit home. Long-term care is just something that perhaps a lot of people are not aware until it hits, and that's why we want to do these shows. Thank you, Lupe, for your participation. And now let me go to Rich. And Rich Stephen is a licensed nursing home administrator, retired, and we also have the luxury of having this kind of folks, you know, Lupe, Len, and Rich, almost like they're like staff to us, and we really appreciate all that you do for AARP and members in the community. So, Rich, let me ask a question then to you. Many people, when they think of long-term care, their minds go straight to nursing facilities, nursing homes, which we know it may or may not translate to that. As Lupe was sharing, there's also HCBS, etc. However, there are circumstances where a nursing facility may be the best and only option. What is some basic information we should know about nursing facilities, nursing homes?
Well, nursing homes come in a variety of different services. There are the skilled nursing facilities, which are at the highest end and usually work very closely with hospitals. And they take residents who are transferred from the hospital to this skilled nursing facility. We think of nursing homes as having long-term stays, and generally in a skilled nursing facility, which many times is covered by insurance, it is a short stay, 20 days, 40 days, maybe 100 days, which sounds like a long time, but in long-term care really isn't. Then you have a nursing home, which is for longer term stays and involve generally less medical level care. It is a transition kind of nursing home that gets people ready to go to an assisted living facility or to go to their home. And so you make sure that you have a safe discharge. And in order to do that, you provide a range of services to build up a person's strength, get them used to dealing with the medications they may have to take, before they can make that transfer to that environment.
What was your general sense of the folks that had to deal with finding a nursing home? Just briefly before we end the show, what was your general sense that you had?
I would guess that 95% of the people, when they had to find a nursing home, didn't know they had to do that until about a day before. And they hadn't spent really much time at all in thinking through that issue. They assumed that the person would go to their house. That might not be possible. And they didn't know the first thing about a nursing home other than all the horror stories they had heard in the newspapers. They didn't know the questions to ask. And most importantly, they had no knowledge of how expensive it truly could be.
Wow. Thank you so much. I want to thank Dana Kennedy, Len Kirshner, Rich Steven, Lupe Solis. This is only our first show. We're going to get deeper into all the nuances of what is this long-term care issue topic. It's just, I just feel that the community needs to know, both in terms of knowing for a loved one, and but more, even more, to prepare for this kind of care, which a lot of times people don't want to think about. We basically say, oh, God will take care of it, my family somehow will take care of it, but there's also ways that we can prepare ourselves. So I want to again thank you both, and thank you, Dana, and thank you to Len, and stay with us, join the ride. This is only the first show. Please spread the word. We're going to be again diving deeper into this matter. This concludes our show, Long-Term Care in Our Healthcare System. Thank you. Have a great day.